Hello, so welcome along to an introduction to menopause. This is something that we have created to give you a little bit more information about how we might manage symptoms in menopause and perimenopause. So I am Sarah Hill, I'm a women's health physiotherapist.
And my name's Leah England. I'm an outpatient at Women's Health Physio.
So let's begin. So I'm going to take you through the first section. So as I said, we're going to look at common symptoms of perimenopause and menopause and how we might manage some of those symptoms. This session does not cover any HRT or any medical management. If you're looking for that, then we recommend you seeking some support from your GP. This is something that we run live as well as a recording. So in this instance, we're not going to have opportunities for questions, but hopefully we might give you some thoughts that you can take forwards for some support elsewhere. So the aims are for us to understand what perimenopause and menopause are, what the hormones are and how they impact us, and then we're going to go on to look at the management. So we're thinking about nutrition, stress management, strength training, bladder and bowels and the pelvic floor, and then some resources that we can direct you to as well. So menopause is the term we use for 12 months after the last period, and the average age in this country is 51. And perimenopause, which we hear more and more commonly now, are the years leading up to menopause. And that can be anything from 2 to 10 years before the last period. You might be finding that periods could become heavier or lighter or more irregular, but we get other symptoms that happen as well due to those hormonal changes. It's really important just to mention that any vaginal bleeding after menopause is not expected. And if that is something that you experience, please do get it checked by the GP. So this slide gives a whole array of different symptoms that we might come across, and some of the ones that we might not associate with perimenopause or menopause as well. So the common things that we might think about are changes to our menstrual cycle, or we might be thinking about hot flushes and things like that. But there are other symptoms which are really common, things like memory issues, difficulties concentrating or finding words, increases in anxiety. You might become more constipated. We might start developing some bladder symptoms. We might get restless legs. We might have changes in terms of sexual enjoyment or reduced libido, and equally might get some muscle or joint aches and pains as well. So this slide just gives us a little insight into what our hormones look like. So we're looking here in our kind of fertile years being our reproductive years, and our hormones go in a nice cycle as we go through that. But as we get to perimenopause, what you can see is that quite suddenly the hormones change quite dramatically. And the first hormone that drops, as we'll see in a minute, is the progesterone hormone. And that's where we start to get some of our changes to our menstrual cycle. But as you can see, it also picks back up again. So sometimes we can feel really, really heavily impacted by symptoms and think, oh, I need to go and see the GP or do something about it. But then suddenly we feel a bit better. And that's because the hormones have picked back up again before they drop down. So it can be quite hard to manage these symptoms. So the tips that we're going to look at today should hopefully help to improve that. So just a little look at three of the main hormones for us to think about today. So estrogen is our primary female sex hormone. Its job is to help regulate our periods and support both our bone health but also our heart systems as well. And it also has an influence on lots of physiological processes. When estrogen changes, you might find symptoms like hot flushes or night sweats, mood swings, anxiety. But we could also get symptoms such as vaginal dryness and discomfort. We might also get things like the bladder feeling a little bit more irritable, more frequency with the bladder, and sometimes a feeling like we've got a urine infection when actually when we've had that tested there's no sign of infection. It's also common to get issues with sleep and joint ache with estrogen changes. The progesterone we looked at on the previous slide, we see that's the one that first becomes inconsistent, and that has the impact on our periods. But it also has a really important role in helping us to manage our pain and is deemed the keep calm and carry on hormone. So when that starts to fluctuate, again, it can also have an impact on mood changes, sleep, migraines, all sorts of things like that. And finally, let's think about testosterone. So testosterone is something we naturally produce in our bodies, and it does spike before ovulation. As it lowers with age, it also plays a really crucial role in our libido. So we might find that our sex drive reduces as our testosterone levels drop, but equally we might find that our energy levels get lower, and also that our muscle and bone mass might reduce as well. So there's lots of things that these hormones have an impact upon. Now, the last little slide before we really get stuck in is just to say that hormone changes can be responsible for so many symptoms as we've just looked at, but they can be caused by other things too. So if you're having any symptoms where you've got changes to your pooing habits, so your poo consistency might be changing, it might be a looser stool, or you're more constipated, and that's not a normal pattern for you, or if you have any visible blood in your poo, whether it's red or black, any bleeding from your bottom, any abdominal pain or bloating, if you're losing weight without trying to lose weight, or you're feeling full very quickly after eating, or your appetite's reduced, or you're having issues with fatigue, please do go and speak to your GP, whether it's menopause related or not. It's something that they will be able to help you address. Next, we're going to go on to looking at some of the ways we manage these symptoms, and I'm going to hand it over to Leah.
Okay, now we're going to look at nutrition and some of the advice that we'd give for people going through perimenopause and menopause and the ways that nutrition can help with those symptoms. So hormones can influence gut symptoms as well as reduce muscle and bone mass. So some of the advice that we'd give is to make sure we've got lots of plant foods in our diet that support our gut microbiome. But also they've got something in there called phytoestrogens that occur naturally in plants such as carrots, broccoli, legumes, and can increase your levels of estrogen naturally. We also recommend eating or drinking enough calcium, vitamin D, and protein, which can help bone mass and also help with muscles. And general advice is that women over the age of 65 should consider taking a vitamin D supplement of 10 milligrams all year round. Now, there are some foods that can trigger a hot flush, and in some cases it's nice to avoid these and sort of see what works for you. Some may or may not cause symptoms for you. So some of the ones that we know that can cause hot flushes are things like caffeine, particularly in coffee, tea, but even things like hot chocolate or chocolate itself. Alcohol can also make flushes and night sweats worse when you do consume alcohol. Also things like spicy foods and curries, but also increasing those, something that you can do to help with hot flushes is increasing whole grains, fruits, vegetables, and reducing fat intake as well. Now, thinking about protein as one of our major kind of sources of making sure our muscles have enough building blocks to grow and stay strong, we want to make sure that you're getting enough protein in your diet, and that can be spread across all your meals. So it's recommended that women that are in perimenopause and menopause that have a 1 to 1.2 grams of protein per kilogram of body weight. So for example, if you weighed 75 kilograms, you'd need between 75 and 90 grams of protein per day. So aiming for about 20 grams to 25 grams per meal. So what does that look like? That could be eggs on whole grain toast, or chicken breast or fish. Could also have things like cooked lentils, cottage cheese, baked beans, peanut butter, or kind of seed spreads as well. So it can look like a variety of things, and it's quite good to kind of spread it out across your meals throughout the day. Calcium is really important for our bones, and in menopause you can have a reduction in bone mass, so making sure again we've got the building blocks for all these things. So things that you can eat to help with your calcium are things like yogurt, ricotta, milk, different types of cheeses, but also things like salmon and broccoli and figs. And I've put the amounts on there and how much calcium you get per amount of those ingredients. You might have heard some things called osteopenia or osteoporosis, and it's more common in women over that menopause age. And by making sure that you've got enough calcium in your diet, ideally recommended at 1,250 milligrams per day, that can help protect against that. Now, we're going to move over to stress management. And to first off, you might not think that that's relevant in menopause. It's kind of relevant all the time. We don't want to be unduly stressed. However, in menopause, there's a really interesting way that stress can play on our hormones. So I thought it's worth us discussing that today. So, stress management is so important because psychological distress and upset can have physical effects, especially in menopause, but also hormonal effects. So we call this the pregnenolone steal, and pregnenolone is kind of a similar thing to progesterone, and it turns into estrogen and testosterone naturally in our bodies. So you can see that on the blue bubbles there. However, when we add stress to the equation, you end up blocking the transformation of pregnenolone into estrogen and testosterone, hormones that we really need in menopause, and it turns it instead into cortisol. Now, some of you may know that cortisol is our stress hormone, and then that kind of picks up stress in our system and causes more of that steal away from those hormones that we need, more into cortisol. So by managing stress levels, we reduce the amount that's stolen away and that we can keep for those important hormones. So good ways that we can manage stress are things like exercise, because that releases our happy hormones and endorphins, relaxing activities and hobbies that you enjoy. You can use relaxation work, kind of deep muscle relaxation techniques, mindfulness breathing, doing things that you enjoy, so self-care, so taking a warm bath, having a massage, watching your favourite film. Also spending time with friends, kind of filling your cup up and feeling refreshed from spending time around loved ones can be really important as well. Sleeping well by using some of the breathing techniques or relaxation techniques that can be really nice as well, and also eating a healthy, balanced diet. So now we're going to move on to something else. We're going to move on to strength training and what benefits we have in menopause, and some of the different types of exercise that we can do that can help as well. So benefits of strength training. We're thinking about increased muscle mass. So as you exercise and work your muscles, they're going to get bigger and stronger. It's known that adults that don't partake in any regular strength training can lose 0.46 kilograms of muscle mass per year from the age of 50. So that there's a natural decline to that. So we need to work on maintaining or improving on that with strength training. It can also help with bone density, because the mechanical loading through our bones helps bones be stronger, and it counteracts that loss of bone mass that might lead to osteopenia or osteoporosis, and has been shown to contribute to a better quality of life overall in adult women. It can also reduce the risk of falling. So if we've got a higher muscle mass, you've got a reduced risk of falling. So on here it says that with people with reduced skeletal muscle mass have got a 2.1 higher risk of falling and a 2.7 greater risk of sustaining a fracture. And that comes down to that muscle mass and bone mass that we naturally lose after the age of 50. So certainly by strength training, we're going to help preserve muscle mass and bone health and help reduce risk of falls. We can also support our tendon health, and now in menopause our tendons become a little bit more tricky. Our estrogen conditions our tendons, and actually without that estrogen our tendons can suffer a little bit. So regular exercise at a nice graded level can help that tendon health tendons to stay strong, and making sure that you're not jumping into any exercise too suddenly, because it can upset those tendons. So a nice gradual increase of activity if you are picking something up that's new. So there's some recommendations from the government. They say that you should have 150 minutes a week of exercise, including 2 strength sessions. So you can mix up between kind of cardiovascular exercise and strength training. And a really nice way to think about getting your exercise in is about movement snacking. So rather than thinking you've got to do this huge session of all this exercise all at once over an hour and it can feel really daunting, you can break that up into smaller sections and snack upon the movement of going for a walk at lunch or doing a little session on an evening, or you can, over the course of the week, snack on exercise. So by the end of the week, you've done lots of different things, some strength, some cardio, some balance things. And that can be a really nice way to increase your activity nice and gently as well. We've also put this in here, so this is from sort of from an activity point of view, from adults and older adults. Goes through some benefits, but it kind of shows you that you can do various different things. So there's swimming, cycling, stairs, minimising sedentary time, so getting up for gentle walks, that kind of thing, and kind of reassures us that actually moving and it's not too late to make a change. The best place to start is today. So we've put together some examples that can be nice, and we've put it into different categories. So we've got balance with a bit of strength exercises, aerobic exercises, and daily activities. Because movement and exercise doesn't have to be kind of structured sometimes, it can be in and amongst your day to day. So balance and strength exercises might look like Pilates or yoga, things like Tai Chi. Strength exercises can look like body weight exercises or exercises that you hold a weight as well. You can also use resistance bands if that's something you've come across. And there's something called high intensity interval training where you pack in exercise in a short amount of time and kind of work on and off with rests in between. Aerobic exercise is lovely as well, so things like walking, running or jogging, doing things like swimming, aquafit, or even cycling, things that get you a little bit out of breath. That's really good for us. And then daily activities, so lifting shopping bags, carrying children, doing gardening or housework. It very much can be intermingled across your week and include kind of, all of these can include kind of individual activities, or they can include social activities, so doing things in a group with friends, a good way to make new friends, or do it with friends and family kind of at the weekends or whatever it might look like for you.
So next we're going to move on to my favourite topic of bladder and bowels. So looking at the statistics, the stats are really high for all of us. So generally we're thinking 1 in 3 women are living with urinary incontinence. 1 in 10 women will have symptoms of a prolapse. 1 in 10 will also have symptoms of fecal incontinence, so accidents from the back passage. But only 1 in 4 of us actually seek help. Now, these problems are really common, but there is lots that we can do to think about managing and addressing them. So things that we're going to think about now are things like leakage from the bladder or the back passage, difficulty emptying the bladder or the bowels. Common problems are also things like prolapse, so a feeling of something coming down inside the vagina, or a heaviness or a dragging feeling. Or it could even be things like pain with sex or pain with medical examinations. So risk factors, there are lots of them. Pregnancy and having babies, that certainly puts us more at risk. Anything where we're doing any repeated heavy lifting, and that could be work related, household related, social exercise related. So we need to be mindful of that. You're also at higher risk if you've got a respiratory condition. So if you've got poorly controlled asthma, for example, or you're a smoker and that gives you a cough, if you commonly get constipated and have to strain on the toilet, if you have a higher BMI, or you participate in exercise that causes those symptoms to come on, they can all put us at greater risk of them getting worse with time. But the key reason why we're here today is thinking about menopause. And as we touched on at the start, changes to hormones can actually have an impact on our bladder and bowel function. So let's move on, looking at the bladder, what's normal. So have a little think amongst yourself, what's normal for you in terms of how often you go for a wee? The normal is every 3 to 4 hours. So if you find you're going for a wee every hour or might go back for a wee 15 minutes later, that's quite a short spell of time that your bladder's holding for. In terms of a normal size wee, what we would expect is 350 mils for a daytime wee, so just over half a pint. We would expect that to be significantly bigger still for a middle of the night wee or a first wee of the day. In terms of fluids, how much should we drink? We're looking at 1.5 to 2 litres of fluid per day, and that doesn't just have to be water, it can include teas and coffees or juices, but we do know that some drinks can affect the bladder, and those commonly are any drinks with caffeine in, so your normal tea, coffee, green tea, um, fizzy drinks, so anything fizzy, including sparkling water, can also irritate the bladder, as well as alcohol. Now, that's not for everybody. Generally, it's 1 in 3 of us are affected by those things. And the effects usually last for up to 6 hours after we've had that drink. So if I have a cup of tea and I'm running back into the toilet, then the likelihood is then it could be the caffeine that's irritating my bladder. If I swap to a decaf tea or a herbal tea, I might find that my bladder feels a bit more settled and I don't have to go quite so often. And is it normal to get up in the night? No, it's quite common from 60 years and above. And once a night's generally deemed acceptable from the age of 70 or more. We can fall into bad habits. So, if we've got children waking us up, or if we're not sleeping well because we're having hot flushes or whatever else, we might go for a week to change that pattern, try and get back to sleep. But actually, that again can cause us issues moving forwards. So now let's think about bowels. So normal for bowels is anything from 3 times a day to 3 times a week. And when you go for a poo, you should know that you need to go. You should be able to get to the toilet, sit down and empty your bowels and without the need to strain or push. It should feel quite comfortable to pass. And when you finish, the bowel should feel fully empty. Now, we have got a little poo chart on the right hand side of the screen, and every women's health physio likes a poo chart. And what we're looking for is what's your normal. So as we were talking at the very start about constipation or changes to bowel habits, consider what your normal is. And the big thing that we recommend to absolutely everybody we come across is that we're designed to squat on the toilet when we have a poo because that helps with our bowel emptying. So let's look at some top tips then. So when we're thinking about bladder and bowel health, certainly think about the risk factors. Is there anything that you can do to make things feel better? And that could be things like speaking to the GP about the cough. It could be considering if I am running and leaking, could I scale that back temporarily while I try and address some of the other issues? There's lots of things that we can look at. We've already talked about nutrition, but we could think about, is there anything we can do to tweak our diet or our fluid intake to help our bladder and bowels be a bit happier? We can get into good habits with the bladder, so try not to go just in case. If you're about to go on a long journey, absolutely go and have a wee before you go. But if you just got home and you're walking past the toilet, you don't need to go just because it's there. You know where it is. Try and avoid some of those patterns. Again, avoiding constipation is key. And then next we're going to think about pelvic floor exercises. Just looking at the diagram there on the right at the bottom, you'll see that lovely picture of a woman sat on the toilet with her feet on a squatty potty. Anything that you can pop underneath your feet so the knees are higher than the hips is absolutely fine. So whether it's a squatty potty specifically, whether it's a box, a packet of toilet rolls, a stack of books, whatever you need to get you into that comfortable, relaxed position is absolutely great. Okay, so pelvic floor exercises are really important. We often find that as we approach perimenopause and as we're postmenopause, that these muscles can get weaker. And these are something that we should integrate into our everyday life to get them functioning, get them stronger, and we should treat it almost like brushing our teeth, a routine part of our daily activities. So let's have a look at how we do them. On the right hand side of the screen, we've got a side-on view of the pelvis, and you can see the pubic bone on the left, which is at the front of our bodies, and the tailbone at the back on the right hand side. And then we've got the bladder, the uterus or the womb, and the bowel labelled. And then we've got a red strip of muscles running underneath, and that's the pelvic floor. Now, the job of the pelvic floor is to help maintain our continence, to help support our pelvic organs, to help with our core stability, and is also really important for our enjoyment with sex as well. So when we get it working, the technique is squeezing tight around the back passage as if you're stopping passing wind, and squeezing tight around the front passage as if you're stopping having a wee. And it should feel like a tighten and lift upwards in the vagina, and you should also be able to feel it relax. And when you're doing it, it should just be those pelvic floor muscles squeezing underneath. We shouldn't have any bum cheek squeezing, leg squeezing. We shouldn't be holding our breath. We don't need one eyebrow to raise as we do it. We're just thinking of the muscles down within the pelvis. Okay. When we think about the basic exercise, what you'll see here is that little green line along the bottom. That's where we're thinking we're at rest. We're looking to try and squeeze so we can see that lift up, hold, and relax. And we're looking to find what you can do. You'll see the very right-hand side of the picture, the line sort of drops down, and that's suggesting that maybe the pelvic floor might be a little bit weaker and you can't hold as strong, or you feel the muscles letting go when you're trying to hold. This muscle, we're looking for quality over quantity. So doing 1,000 rubbish ones is not going to make any difference, but doing 3 or 5 or up to 10 good ones is what's going to make the difference. So we're looking for that lift and the relax. So let's think about what it can look like. We want to do that one squeeze in 2 main ways. So we want to do some slow squeezes where we squeeze and hold for up to a count of 10, relax, and do up to 10 of those in a row. Now, for fun, I'm going to count to 10 and we will see if you practice along, do you feel you can hold it? Do you feel that it's letting go as we go along? So let's practice. Squeeze now for 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and rest. You might think 10 feels fine. I can feel the squeeze, the hold, and the relax. Your task now is to work out how many you can do in a row up to a maximum of 10. You might think, oh gosh, I can't hold it at all, or I can only hold it for 2 or 5 seconds and then it starts to drop away. The aim here is for you to work out what your starting amount is. So how many seconds can you hold for and how many times can you do it? We then want to try and do some fast squeezes. So we're going to squeeze and rest, squeeze and rest, squeeze and rest. And we want to try and do up to 10 of those. Again, you might think I can't do any at the moment, it's too difficult. I can only manage those slow ones, or maybe I can just do 3 or 5. We're looking to do both up to 10 of the slow and up to 10 of the quick ones 3 times in a day. And we're looking for normal breathing. When the muscles start to get tired, that's fine. You can stop, rest, pick it up again another time. As long as there's 1 hour between each time when you do the exercises, you can do them all of a morning, all of an evening, or you can spread them out throughout the day. You can do them when you're lying down or sitting or standing, and you can also make them functional. So if you know you're about to cough or sneeze or lift, squeezing those muscles first helps to offer some support before that pressure comes on.
So here we have some helpful resources, such as things like understanding more about menopause from the NHS website or Menopause Matters, different kind of cafe meetups so you can talk about your experience with menopause with other people going through the same thing, and things like the Squeezy Pelvic Floor app, which can help with guidance of that pelvic floor squeeze and can offer reminders and helpful tips to do them. And then other things that we've got on there, kind of like our pelvic floor exercise video websites, and also some menopause library.
So we hope that you found this session helpful today. There might be things that you've picked out where you think, oh, I can go and implement that advice and it might make a wonderful difference to how you're feeling. But equally, you might pick out some things where actually it's a struggle. You can hopefully identify some of those issues a little bit better, and often your GP is a great first port of call, and they could help with additional things and signposting as well. If it's something more pelvic floor related that you're concerned about, again, the GP is the key person to help with any referrals that you might need with managing these symptoms moving forwards. We wish you all the very best.